Maine Medical Center is making some changes to its COVID-19 employee protections, and the hospital's new nurses union isn't happy about it.
A group of union nurses held a news conference this afternoon to call on the hospital to keep the protections the way they have been since the start of the pandemic. News Center Maine's Jackie Mundry is outside Maine Med tonight with the details. Jackie?
Pat and Cindy, that press conference was held before we received official confirmation on what protections were in fact changing. The hospital says some of the protections are, the union says those protections are going away, but the hospital says that's not exactly true.
Dear Maine Med, show us that you're willing to see us through the entire pandemic.
Maine Medical Center nurses like Madison Light say the pandemic isn't over. In fact, the nurses union says there have been 6 COVID outbreaks across the hospital over the last few weeks.
We are still in a novel virus environment. The precautionary principle still applies today.
Jonica Frank works in the operating room.
By the time management told us we were in the middle of an actual outbreak of the virus, we already knew.
At the start of the pandemic, a number of protections were put in place.
Last year, Maine Med did some really good things.
Those things are allowing high-risk employees to not work directly with COVID patients, covering the cost of treatment for employees who did get COVID, providing quarantine pay to employees who have been exposed to COVID, and giving paid time off for employees who are 37 weeks pregnant. But by next month, National Nurses United and Maine Medical Center say those precautions will change.
Nurses and caregivers are exhausted, frustrated, stretched to their physical and emotional limits, while still trying to provide the best care that we can for people that come to us for help.
The union is asking the hospital to keep employee protections as they are, and for management to be more direct.
In the middle of a spike of infections from a fast-moving variant, this is not the time to remove the protections that have helped both staff and patients here for the past several months.
Late this afternoon, Maine Med released the details of the changes to the employee protections. They include requiring employees to use paid time off if they are exposed to COVID-19 outside of the hospital. And pregnant women may continue to work after the 37 weeks as their individual conditions allow. Maine Med says that it did notify union officials of these changes. It did not receive any objections earlier this summer. You can watch the full press conference and read Maine Med's full statement on our website and app. Cindy?